Hello and welcome to our Women's Health Edition, episode number 6, I believe now. And today we're going to be talking about all bioidentical hormones. Well, all is a pretty strong word, but we're going to talk about bioidentical hormones and the most common ones that women need when they progress into menopause. So I think, first of all, we'd start with some definitions. So what are bioidentical versus natural versus synthetic hormones? Janet, I'm going to let you start,
Sure.
but I'm going to have a lot of things to say about this.
Okay, so let's back up. Bioidentical hormones should be used throughout your entire life. I am not a fan of synthetics in younger women as well, because that is, in my opinion, very dangerous to their health long term.
So synthetic hormones are what she's talking about. We'll get more into the details. Is birth control pills.
Right. So bio basically means life. And really, when you think about it, we as humans should consume things that are identical to our body. So that's basically what the definition is going to be: identical to the human body. There's many things out there that can be natural, but natural to what and to who? For example, we have Premarin that is a natural product from a natural source, but it's natural to equine or horses, not humans.
Premarin stands for pregnant mare's urine. Yes, Premarin is horse pee. I don't pussyfoot around anymore. Premarin is horse pee. That's what it is.
So when we first started in our research or big pharma to come up with hormones for women, the first estrogen on the market in the 1940s was Premarin, which, okay, maybe that's what we came up with, but we're 2024, and we actually have hormones that are identical to our own body. Let's back up there. We are humans, not horses. So why are we still prescribing things that aren't
identical to what's in our bodies? Well, I'll tell you, I'll give you a little hint.
Right.
Here's why.
So in the pharmaceutical industry, we used to use pork and beef insulin for humans before we could make recombinant human insulin. I understand that. But now we have something better. We have something identical to our own body. So when you have somebody who's saying, oh, well, this is a hormone that, has estrogens for women, if it's called Premarin or conjugated estrogen, it might have one component that's identical to you, but there is multiple products or multiple equine estrogens in there that we haven't identified all of them that you're consuming. So why would you do that when we have something better? Why would we go back to the 1940s for women? And really, I'm a little bit passionate about it because it really frustrates me that we're still in the 1940s. We deserve better.
Absolutely. So Premarin, like she says, is natural. It's natural to a horse.
Right.
Is it bioidentical to our bodies? Mm-hmm. No. It's bioidentical to a horse, and each horse has different urine. So we don't really all know what's in Premarin. They do standardize it to a certain estradiol content, but there's 19 different estrogens in there that we know of, many that we don't know of because it's a natural product. So that's one of the reasons it's never been patented, because it can't be, or that's one of the reasons it can't be a generic, right, because nobody knows what's in it, so you can't copy it. It's unbelievable it's still on the market. Well, but that's what drives it, is money. Right. Money drives it, and basically Wyeth Ayers has
us.
Yeah, shame on us for dispensing it or for doctors prescribing it. They should never ever do it, because we have something different, right, called estradiol. Right. Estradiol is bioidentical, life identical to what's in our bodies.
Right.
So back on synthetics. Are all synthetics bad?
No.
Can you have a synthetic that is bioidentical?
Yes.
Of course. Let's use a great example. Thyroid. Bioidentical thyroid, levothyroxine, liothyronine. Our bodies make up T4, T3. T4 is levothyroxine, T3 is liothyronine. and levothyroxine is less potent than liothyronine and has to be converted to liothyronine to be more potent. So, how is levothyroxine and liothyronine made? It is synthesized in a laboratory. It is synthetic. There's no doubt about it. It's a pretty simple molecule.
Right.
L-tyrosine and 4 iodines for T4, L-tyrosine and 3 iodines for T3. Pretty easy synthesis reaction in a lab. Is it bioidentical?
Yes.
Yes, it is bioidentical, even though it's synthetic. So let's compare that to the natural thyroid, nature thyroid, armor thyroid, NP thyroid. Also, the generic name would be porcine thyroid. Porcine thyroid is literally ground up pig's thyroid. It has been around for probably close to 100 years now. It was a gold standard 100 years ago. That's all we had because we didn't know how to synthesize levothyroxine and liothyronine yet. It's kind of a little bit like, or a lot like Premarin, in the fact that it's isolated or it's ground up pig's thyroid. There's stuff in there we don't know what's in there. It's standardized to a T4 T3 ratio, and does have iodine in there also because thyroid glands have iodine. How much we don't know because it varies from batch. But that being said, it is a natural product to pigs, not to humans. Now, I will say this about NP thyroid. I would be a proponent of NP thyroid over just levothyroxine if the patient is not doing well on levothyroxine.
Right.
But I would never be a proponent of Premarin, ever, ever, ever.
Well, I don't feel, even when we start looking at other countries across the world, Europe does not allow Premarin. So and again, it's because we have something better. If NP did not have the components that worked, I would never recommend it. Now, there are times where I feel that synthetic, which is identical in thyroid, is superior to NP in different cases. And that can come down to just what that individual patient needs. It's not always that I don't say that it's okay. It's just that there's times where there's something that might work better. So we have to be careful about the natural and the bio and synthetic, because there's times where one might be just fine. It's just that what are you looking for and what the product is can determine whether or not it might be good or bad.
So now let's move into, now that we have that established, bioidentical versus natural versus synthetic. Let's also establish this, is that when we use the term hormone, I think we've talked about this in this series, but I'm not sure, but it's worth going over again. When we use the term hormone, that's a very broad term. Insulin is a hormone, okay? So we have to we should be getting pretty specific when we say hormones.
Right.
Typically, we talk about sex hormones that are made up in the ovaries and made up in the testes. So testosterone, progesterone, estrogen. DHEA is made up more in the adrenal glands. But we have to really be specific when we talk about hormones. So if you go to a doctor and you have a history of breast cancer or whatever, and he says go off all hormones, that is a doctor that is ignorant, because insulin's a hormone.
Right.
Cortisol's a hormone. Cortisol's a hormone. Epinephrine is a hormone, also known as adrenaline. So, and we would die without it. So thyroid is a hormone. So you got to be specific about, hormones being bad versus good. What kind of hormones? Okay.
Right. And also, sorry to interrupt, but also to think about this, it's not just our ovaries or testes, like Shawn alluded to, the adrenal glands. And for women, when we go from peri into menopause, our adrenal glands start producing some of our hormones again. So you still may be producing estrogen and progesterone, just not at the level of your ovaries. So just because someone says, oh, well, I'm going to take your ovaries out, you're not going to produce any estrogen. It's a lie.
Yeah,
it's a lie, folks. Totally they aren't understanding biology.
Right.
Your adrenal glands are now the primary function of those hormones. And Shawn and I have talked about this in earlier episodes, but the definition of hormone is really a messenger. So every cell on our body is going to receive a message for a function that needs to be performed. Whether it is, let's make new bones, or hey, my gosh, there's something chasing me and you need some adrenaline to fight or flight. I mean, every cell requires a message to perform a function. So to say that hormones are bad for us or we shouldn't have any is counterintuitive to life.
And it's just ignorance. It's pure ignorance.
So there has to be some understanding that even if, for example, somebody says, you shouldn't have any hormones. Well, if you're still walking, if you're still living, you really need hormones.
Absolutely. So let's go into some of the individual hormones. So we're gonna focus this topic on women, of course. So let's just start with estrogen. Mm-hmm. First of all, estrogen, I already alluded to, is a sex hormone made in the ovaries, mostly when our ovaries are productive, or I should say, women's ovaries. I don't have ovaries, obviously. But let's get specific about estrogen. Mm-hmm. So when and I'm even guilty of this because it's just easier to say estrogen, but there are 3 different estrogens in the body. So we typically put them all into one category, but they're not. They're different. They're all different. Mm-hmm. So there's 3 estrogens in the body. Estrone, which is also known as E1. Estradiol, also known as E2, di for 2. Estriol, tri for 3. So those 3 are the major estrogens and the only estrogens in a woman's body. Right. Besides the metabolites of those, for elimination, essentially. So let's just go into estradiol is the most, I'm not going to say the most important. I'm going to say it's the most popular.
It is the most potent, though.
And the most potent, right. Correct.
The potency in the body is much higher.
Correct. And so it works the most for like hot flashes, vasomotor symptoms. It's the one that's most studied for bone density, for basically
brain health.
Most of the things that we know about estrogen. And one of the reasons why it's been most studied is because, first of all, in Premarin, estradiol is standardized to a ratio of, I think it's 19% of it is estradiol. So it's mostly estradiol, not mostly estradiol, but a major component is estradiol. So, and that's the one that's been most studied. And then later on in the United States, we had, and still do have, estradiol. It was commercially available under Estrace. Now it's generically available under estradiol tablets, also estradiol cream. So those are the ones that are most studied for vaginal health, whether it be atrophic vaginitis or vaginal dryness, whether it be to prevent urinary tract infections, whether to treat or prevent urinary incontinence. That estradiol has been studied the most. So that's the one that is the most talked about. Estriol used to be commercially available in the United States up until the 1970s, and they took it off the market. Not because of safety reasons, but just mostly because of economic reasons. It wasn't selling well enough. But it's very specific for, it's a weak estrogen. It has 80 times less affinity for the estrogen receptor than does estradiol. But it does, so it blocks estrogen receptor, but it doesn't bind as hard as estradiol. But it's also very specific for urinary tract and urinary health and vaginal health. So actually there's a commercially available products for canines now, for dogs, that is estriol, and they use it for dogs that have been spaded and don't have ovaries anymore, and they start having urinary incontinence. So estriol is very, very effective. There's lots of studies out there to show how it works for vaginal health and urinary health. So the third one is, actually the first one, E1, is estrone. And that's more of a storage estrogen. We store that in our fat. So most people have enough estrone. They don't need more. And estradiol can convert into estrone. So we don't typically give any estrone. We only give estradiol and estriol. Those combinations, estradiol, estriol, are also known as bi-est, bi meaning two, est, two estrogens. So typically women are associated with estrogen only. And that, when you go back into the 1940s when Premarin came out, basically, I think it was that big pharma was really pushing estrogen, so they could sell their product. But we don't want to forget about the other sex hormones, like what, Janet?
Well, before we go there, just to dispel this right now, men have more estrogen than women. They have more estradiol than women. We just have more sensitive receptor sites because of our DNA and our chromosomes. So we respond to much lower levels. So when we talk about sex hormones, we have less than men as far as estrogen, and that includes E2 or estradiol. So to think that, it's just we are emotional because of estrogen. Mm-mm. We've been taught differently, right? But so what was your comment again?
Well, I was just going to say, I mean, the thing that the XY chromosome, the Y that makes us a man, that the hormone that really separates us is the Y chromosome starts producing testosterone, and that's what makes us different. It's testosterone, not estrogen.
So every cell on our body requires a message, and we have receptors for all of our hormones on every receptor. So the other hormones that we talk about that are super important, and sometimes I focus on this one with my clients more than even estrogen, is progesterone. Shawn and I have talked about progesterone before, but just like its name, progestation. It's one of the oldest hormones that was ever talked about historically, because it stands for progestation, meaning to maintain a pregnancy. But the purpose of progesterone in a woman is to balance the amount of estrogen. And also, once she, to become pregnant, for one, it helps with fertility in the cycle. It also helps with implanting a fertilized egg into the womb, because our uterus, if it's not with the right mucus makeup, if it's not, the environment's not correct, things don't happen in the fashion that we would want them to biologically. So it's very important that it be on board once we've ovulated and released the eggs, so that if we choose to become pregnant or impregnate into the body can be maintained. And once you become pregnant, the corpus luteum starts producing huge amounts of progesterone to maintain that pregnancy until the child or the fetus is born as a child. So where else it plays in our body is something that, and this is the reason I focus on it, is because it tells our body to make new bone cells, new osteoblasts. It also helps with our sleep cycle. And Shawn and I talk about this over and over and over again. This is something I hammer home with all my clients. If you're not sleeping well, you're not repairing. That means you're not recovering. That means that you are not mentally, emotionally, and physically becoming healthier as a human. So where this happens in the brain is that progesterone turns into, or is made into, L-pregnolone, which helps with your REM cycle. And in the REM cycle, there's 4 stages, but in the REM cycle, it's part of our pattern. You start repairing. I think it's the 4th. Does that sound right? The 4th.
I think it is. Yeah, it might be the 3rd.
But here's the point. If you're not sleeping, you're not healthy.
Nothing gets better.
You don't feel healthy. Your emotion, your mental health, your physical health is in the toilet. And that's why it's so, so important for overall health for women, is that they have enough progesterone on board, no matter what age they are in. It comes a little bit harder as women start going into peri and into menopause, because their sleep cycles start changing because of the lack of progesterone. And usually it's the lack of progesterone first that is probably the culprit for a lot of the symptoms they're feeling. Yes, they might have a shortage of estrogen and maybe having hot flashes, but so many times it's coming down to the progesterone hormone.
And here's one of the biggest fallacies in medicine about progesterone, I'm going to back up onto Premarin again, okay? So we're taught that women only need estrogen, and we are taught in pharmacy school, in medical school. Um, most OBGYNs are taught in medical school that women just need estrogen.
Right.
And they don't need progesterone unless they have a uterus. Okay. Now, that's the biggest fallacy one of the biggest fallacies we're taught about hormones in medical school. And I'm going to tell you this: if you watch this episode and you know these things about this episode, you will know more than most OBGYN doctors know, and definitely more than most pharmacists know about hormones. I'm not kidding you. So here's the thing about progesterone. 10 years post marketing of Premarin, we realized that women were having uterine cancer. And we really shouldn't be surprised. When you give a woman estrogen only, it stimulates their uterus to grow, their uterine tissue to grow, proliferates uterine tissue along with breast tissue. Progesterone helps decrease that proliferation. Okay. So it helps the tissue from getting too thick. And so post Premarin, 10 years post, after coming out with after Premarin was been out for 10 years, we realized women were getting uterine cancer. We also realized, the scientists realized, well, progesterone helps to decrease that uterine proliferation of tissue. But you know what? We can't patent progesterone. Progesterone is a natural substance. We can't patent it. So let's mimic something like progesterone. What they come out with, medroxyprogesterone acetate. Medroxyprogesterone acetate mimics progesterone in the uterus somewhat. Okay, so it decreases the uterine proliferation. It does not increase bone density. It does not. It increases blood clots. Actually, it does not help with the brain, like Janet was talking about. It doesn't help with most of the things that progesterone helps with. Sleep,
maintaining a pregnancy.
Right, maintaining a pregnancy. It does decrease the incidence of uterine cancer, and that's why we have Pro, Premarin plus Provera, medroxyprogesterone acetate. So I'm going to tell you this little tidbit, and if you know this, you will know more than most anybody about sex hormones. Progesterone. What does progesterone mean? Progestation, to support a pregnancy. What do we use medroxyprogesterone acetate for? Depo-Provera. We use it for birth control. When I tell that to a gynecologist, their bingo light goes on. They're like, wow, these things really are different. Of course they are. Small molecular changes in a structure of anything can make huge changes in the body. Remember, proteins in our hormones act in a 3D fashion to interact with proteins. So if they aren't perfectly aligned, if they have just certain changes in a structure, small changes in a structure, it's going to make huge implications in the body. Case in point, testosterone versus estradiol. Look at the structure of testosterone versus estradiol. They're pretty similar. Yet if you have enough testosterone, you will be a man. So that's how different they are. So medroxyprogesterone acetate does not equal progesterone, and you need progesterone all the time, whether you have a uterus or not. But we're taught in pharmacy school, and doctors are taught that if you don't have a uterus, you don't need progesterone. What does that mean? Do you not have a brain? Do you not have bones? Do you not want to sleep? So that is a big fallacy when it comes to hormone replacement. Progesterone is so underutilized. And when is it, Janet, that typically or when a woman contacts us that might need hormone replacement?
Well, at our pharmacy, we get calls for all ages. So, but perimenopause is a time where women start noticing a lot of changes in the amount of cycles they're having, the lengths of cycles. So that can change for them then. And many times they approach us because either they are told, well, you can go in and have an ablation, or you can go in and you can have a hysterectomy. For conveniences, it might be nice. Wouldn't that be nice not to have a cycle any longer? Or if she's having heavy bleeding because She hasn't had enough progesterone that her lining becomes really thick. So when she does have a menses, it's just very, very uncomfortable and very heavy. So that's times that we start seeing faces or calls about a cycle. And so I'm just going to come up front before we dive into some of these things. But my opinion is this: you're going into your primary or your OB, and it's no different than any other form of business. Yes, it's your body, but they're there to make a sale. They're making you a sale. They're pitching you a sale. I'm going to offer this service for this reason. And usually, what I tell women is run. Find somebody to help balance your hormones, because usually what's happening is as you're transitioning, you do not have enough progesterone on board. And so, therefore, this is causing some of the havoc. If you do choose to do some of the things that they want you to do, no judgment on my part, but just realize if you have a hysterectomy, it takes 10 years off of your life. That's a minimum. And that's just from studies that are out there of watching historically how women age if they've had a hysterectomy versus not. So it's not it's not like some big scientific, dive into this. But why are we removing body parts if there's something natural that we can do? I'm just opposed to removing organs and
If not
parts if
necessary.
it's not necessary. Why open yourself up to a procedure if you don't need to? So, especially when there's things that can be done naturally during a process that every woman's going to go through. So, I'm not shaming anybody for their choices, but I'm just saying that the alternative to going through menopause and perimenopause in a more comfortable way might be to balance your hormones, and progesterone plays a big role in that.
And surgery, there's no reversal for. Once you
Nope.
have the surgery,
Once
you're
it's
done.
done.
So whereas hormones, if they don't work, it's probably because they're not dosed correctly,
Right.
or you're not going to somebody that knows the proper way to prescribe hormones, i.e. the balance of hormones, not just estrogen, but progesterone and testosterone and DHEA. We'll get into both of those. And if you go to a doctor and they think, hopefully we're beyond this, but if they think that you as a female, that your uterus and your ovaries are only for reproduction,
Right.
leave. I mean, if they say that, just don't even say bye. Just leave. Get up and leave.
Right.
I mean, think about this. This is the analogy I use. Do we ever cut out men's testes?
Not anymore.
No. I mean, we used to for prostate
Yeah,
cancer,
not
but
anymore.
we don't do that anymore. So why should we routinely do that for women? Cut out their ovaries. They're analogous tissues. So let's talk about testosterone.
Well, before we do,
Okay.
I just need to jump into this one.
Yes.
Because what women don't realize is, okay, I'm in my mid 40s. Oh, it sounds so convenient not to have a period. Well, let me just tell you about what happens in your 70s, 80s, and 90s.
Yeah.
If you don't have intact body parts, women have prolapse. So that's when part of your body is prolapsing out of you. And many women that have had hysterectomies have that problem. Yes, women that have carried and had multiple babies sometimes have that, but that's a huge problem. Not fun. Not fun. And the other place that it plays a role in is your bladder and your urinary health. So if we don't take care of these things now during menopause and as we go forward, I, for one, am not going to be a candidate to have all these measures of a sling or a mesh.
Or wear a catheter.
Or wear a catheter. And what happens to women is they have this reoccurrent infection of UTIs just because of how we are made as a human. The proximity of body parts and also the lack of hormones. We don't have the tone of the muscle sphincters any longer. We have the anatomy parts that are very close to each other, and the pH changes without these hormones. I, for one, do not want a mesh. I do not want a sling, and I do not want a catheter. So I will do everything in my power, whether it's exercise, the right pH with hormones, whatever it takes not to go there. And, when you're young and you have a UTI, it's like, whatever. When you're 80 or 90, it can be life-threatening. And these are things that people never, ever talk about. But if you talk to your grandmother or your mom, depending on what age, how many of their friends or how many women out there are suffering from UTIs, or even talk to a nurse that works, in a nursing home or an OR. It's an ongoing health risk and problem that is just not dealt with in the proper way. And I'm kind of a little passionate about it because I can't tell you how many women I know that are walking around with these foreign things in their body and they're uncomfortable and it's not fun. There's better answers.
And all they needed was proper hormones balanced.
Right, exactly.
So let's go into testosterone. We've got a few more hormones to go through when we finish this episode on all about bioidentical hormones for women. So testosterone. Testosterone is not just for men.
No.
Women make testosterone also, just a lot less than men. So when we dose women with testosterone, we dose them with a female dose, not a male dose. So they don't get a deep voice. They don't grow a beard. They don't get big muscles. They just get the benefits of testosterone. And what are those benefits, Shawn Michael? I mean, sorry, Janet.
Our son was over.
Our son was just over. Sorry.
It was just over. So, okay. So like Shawn mentioned, the benefits for women, the first one I'm going to mention is bones, because that is something that, again, as we get into my women that are in their 90s or 80s, I want those women to have the healthiest bones that they can possibly have. There's no better hormone or drug out there that helps to build strong, solid bones. And let's remember, bones are dynamic. We're humans. We are not dinosaurs. We are not glass, right? So all these Fosamax and all these other drugs that are out there,
Prolia, Forteo,
FDA approved for
garbage.
you women, they're making your bones old. They are not replacing the tissue. Bones are tissue. We need to put new bones down and take the old out, and that process needs to happen throughout our whole entire life. So what does that set us up for? Well, if we fall and we're on one of those meds or we don't have strong bones, we might break a bone. But if you're on certain meds that we standard of care, right? We shatter it like a glass that's breaking. It's crumbled. Game over. You have 3 months at most to live, and it's miserable. So don't go down that path. If you're on it, get off of them.
If you have weak bones, you need hormones.
You need exercise, you need hormones, and you need proper nutrition. And the other place that I find that is super important is as we go through perimenopause and menopause, our body's ability to rebuild muscle, lean muscle changes. Well, if you have enough testosterone, you can maintain your lean muscle mass. And why is that important? All mortality, I believe, is
all-cause mortality.
All-cause mortality is linked to this. I mean, our heart health, because we have less abdominal weight that's putting on around our visceral organs. So we're not putting fat in places that are unhealthy for us. It keeps us moving longer. It keeps our core stronger so we have good balance. And so it's super, super important. It also, to some degree, I really believe it helps with our brain health. I mean, we talk about this with men. We talk about with men because we see this with andropause with them. But testosterone goes into our brain too, and it's a mood enhancement. So if we feel better, we move better, we have stronger muscles and bones, of course we're going to live longer and be healthier. But now I'm going to jump into a very intimate part of our life. And this is something that I really am frustrated with our society, and here's why. Testosterone is super important to libido. So for women, we're actually kind of looked at kind of strangely if we talk about this. Like, why is sex important to women? Why would that be so important to us? Well, let's think about this. It's a form of communication between you and your partner, your husband and you. If it's a problem, you're going to face it somewhere along the line. I personally am not going to accept, oh, it's just part of life. You don't need to enjoy sex and intimacy any longer with your husband. Just live with it. Just deal with it. And if you want to, let's just give you some lidocaine so you're numb and it doesn't hurt. It doesn't hurt. As a woman, I think that whole story and myth is garbage. I'm not buying it. Sex is important to intimacy between partners, throughout their whole
whole life.
entire relationship.
And whole life.
And guess what, folks? I've seen so many women that once they've had enough testosterone that it brings back the intimacy and the part of that relationship that's been lacking for a while. And there's so much joy and happiness in that. That's a blessing. That's part of life that we should, as a woman, be able to say to our physician, hey, I'm struggling here, without being looked upon like we're strange or that we're asking for something that's impossible, because it's possible. In fact, I have many women who have told me over and over again, you saved our marriage. You saved our relationship, because she said, or they have said, I'm interested. This is amazing. I didn't think I could be in this place. Well, I was in my 30s, and now I'm in my 60s, 70s, and 80s, and I'm enjoying life in this capacity. Why can't we embrace that in our society? It's really, really sad. So here's the thing. We just need a small amount. We need less than men, but it makes a big difference in how we feel mentally, physically, as well as sexually.
And when you think about it, our 50s, 60s, 70s, think about our intimacy then with our spouse that we've been with for 30 years. It should be the best it's ever been.
And going forward.
Right. Because think about this. You've experienced each other for 30 years. Nobody knows you better than them. You've done everything, had babies together, and seen everything that comes along with that. And now you're usually empty nesters, and usually you're more financially secure. Usually it's just a better time overall. And why not enjoy it with better sex? And there's no reason you shouldn't. And if you go to a doctor and the doctor says, as we get older, sex isn't as important, you leave right then. And you call us, because we will find you a doctor that knows that sex is important in your 50s, 60s, and 70s. What if we had a drug that could decrease depression, increase lean body mass, increase bone strength, increase vaginal, decrease vaginal dryness, decrease urinary tract infections, decrease vaginal atrophy, decrease depression? Maybe I said that. Increase libido. What if we had decreased visceral fat, which would decrease blood pressure and decrease diabetes? What if we had a drug like that? We do. It's called testosterone. Think about all the drugs that you can get rid of: blood pressure, depression, diabetes drugs, just by using testosterone and getting your testosterone
I don't
level
even like
optimized.
calling it a drug.
No,
it's a natural
it's a
hormone that we are blessed with, and as it decreases,
we can replace it.
Right? And we're not talking about bodybuilder, misuse. We're talking about therapeutic levels that bring people to optimal places. So the other thing, before we go on from this, and this is what I've said to women in this situation when I'm counseling them. If you realize that this is an issue between you and your husband, you know what? You need to address it. If you care enough about your relationship, you need to address it. And I strongly believe there are many, many marriages that can be repaired or be in a better spot, or they can be enjoying life together better if we take the initiative to say, hey, I'm not going to accept this is just a part of life that you have to put up with. Because I just really think it's super important. And, Hollywood and the news out there and whatever they want to paint the picture about intimacy and relationships, I'm just not a part of that anymore. I'm just like, I've had enough. This is a special part. This is part of a blessing of a relationship with intimacy between a spouse. Don't give up. There are answers and solutions. And you might be the one that has to do something about it, ladies. And it's okay. And if that person says something to you that's derogatory or rude or is not appropriate, there are providers that will help you.
Healthy people have regular sex.
They do.
And regular sex keeps you healthy. And by the way, regular sex is not once a year, birthday sex, anniversary sex, whatever the heck that is. It's not once a month. I don't even think it's healthy once a week. Everybody's definition is a little bit different on what regular sex should be to keep you healthy. But there's no reason that both of you should not want to have sex at least daily. And women, If your husband doesn't want to have sex daily, that's a problem. And it usually means that he has lack of testosterone. Decreased libido in a man is the first symptom of low testosterone in general. So let's move on. We got a few more hormones to go through. I'm going to go through DHEA really quick. Go through DHEA, Janet, then we'll go through thyroid, and then we'll talk about dosing.
Right. So DHEA is really overlooked because it's really made by our adrenal glands, but it's super important because even though it's a lot of times when I recommend it, people think, well, it's over the counter. So why is this over the counter if it's a hormone? Well, it is, thank goodness. Women need less than men. We both need it. The level of DHEA, in my opinion, is important because it's kind of a marker of how we age. And if you have a low DHEA, you really need to supplement it because it's really a marker of your mental and your brain health. And it does help to some degree with our function of our triglycerides and cholesterol. Now, I'm not somebody that is buying the story that we have to have extremely low cholesterol to be healthy. I think it's probably in reverse, and that's my opinion. But DHA is really a big marker. If you have too much as a woman, sometimes it's acne, but it's inversely proportionate to how you age. Many people that I see that are in their 70s and 80s, if their DHEA is running low, their cognitive abilities have decreased with time. What am I missing?
I think that's good. DHEA is typically classified as an androgen. I don't like that term because it's associated with males, but that's why males do need more DHEA than females. And DHEA can convert to testosterone at higher doses. Usually that's not until 50 to 100 milligrams for women and 200 plus milligrams for men. But if you need more testosterone, don't take DHEA because of it. Just get testosterone. DHA does help for vaginal health too. Some of the same things, you use it topically, it'll help for vaginal health. Some of the same thing that testosterone and estrogen can do. Let's go ahead and move to thyroid. Then we'll talk about dosing and side effects.
Well, before we do, I just want to jump in. When we talk about adrenal health, I think this is important. DHA also can affect, if you're seeing low, your adrenal functions, and cortisol comes from your adrenal glands. So that is
miss that.
Yeah, we did miss
so
that.
So DHA helps us respond to stress.
Right.
That's when I typically think of DHA. That's what I think.
Which is a big thing, folks. We need to be able to respond to stress in our life in a healthy way.
So thyroid, we already hit on really quick about T4 and T3 and the differences in them earlier in this episode. But they're a thyroid hormone, not a sex hormone. But they're so important, and they usually do decrease as we age. So if you have low thyroid, you'll have symptoms of decreased energy, cold extremities, constipation, thinning hair, decreased libido, weight gain, basically a lot of the same symptoms of low testosterone. That's why it's important to check both at the same time. And so it's important to know to go to somebody that knows how to dose thyroid appropriately, or all these hormones appropriately. Because here's the reality. Most women will need a balance of all these hormones. So estrogen, remember that's the generic term, estrogen, progesterone, testosterone, DHEA, and thyroid. Most women will need a little bit of all those, or maybe a lot of some of them. So it's important to know how to prescribe those in balance without getting side effects. What are some of the side effects? Some of the side effects of too much estradiol would be breast tenderness. That's one of the first side effects. Remember, because it increases proliferation of breast tissue. So that the good thing is that when you get too much, because you'll have breast tenderness. And if you're having too little estrogen, then you'll have hot flashes. So that's a good way to dose it without looking at lab numbers, because labs are just a tool to go along with symptoms and history. Progesterone, if dosed appropriately, very safe hormone, very little side effects. Remember, when you're pregnant, your levels are 1,000 times higher than they are when you're not pregnant. That's how safe of hormone it is. You might get a feeling of breast fullness because progesterone prepares the breast for lactation. So you'll get that feeling. And then too much testosterone, you'll get oily skin or acne. Those are all short term. If you get too much oily skin or acne, you just back off of the dose. Same with estradiol. If you get too too much. If you get breast tenderness or progesterone breast fullness, you just back off on the dose. That's what's cool about oral dosing or topical dosing. You just use it every other day or half the dose, something like that. DHEA, same thing.
Oily skin.
Side effects,
Acne.
oily skin, acne, because it's an androgen. And then same thing, you just use a lower dose. And those side effects are very short term. Right. So are bioidentical hormones safer than synthetic hormones?
So here's the thing. We already defined this, right? Bioidentical can be safe if used appropriately, and so can some synthetics. So I use synthetic thyroid, and I have.
But that's bioidentical.
But it's bioidentical to my body. It's not the same thing as buying something that is not identical to my body. So can they be done safely? Absolutely. Here's what I usually tell people. Most practitioners that prescribe hormones that aren't fluent or learned usually underdose people. Rarely do I see them overdosed. So they don't always optimize them. So here's the thing. Safe use, optimize the amount without side effects, and they can be done very safely. But again, here's the other component that Shawn and I talk about. We already talked about sleep. You can't take enough hormones to get you out of a bad diet or a bad exercise lifestyle.
I mean, you still have to do those things right.
You have to, they all come together in a piece of the puzzle. So they are beneficial. They can help you with metabolism. They can help you with, healthy skin, healthy integrity of your muscles and tissue. But if you don't do all the other things necessary to be helpful.
Right. And here's the thing about bioidentical hormones. So the stigma of hormones is, when there's a lot of ignorance out there. The WHI study in 2002, I think we've talked about this in this episode, in this series, but not all hormones are created equal. So you can't compare bioidentical hormones to Premarin. You can't compare it to Provera. Here's the rational thing I tell people. If bioidentical hormones caused cancer, then young women in their 20s, when their estradiol, when their progesterone, when their testosterone is the highest, they would be getting cancer.
Or when you're pregnant.
Think about how high your hormones are when you're pregnant. Your progesterone level is 1,000 times higher. Women don't typically get cancer when they're pregnant, and many women feel the best they've ever felt when they're pregnant. So it's not about hormones, people. In fact, you could argue it's about lack of hormones. So when people have lack of hormones in their 70s, that's usually when they get cancer, their 60s and 70s. Well, why could that be? Well, let's say they're up all night having hot flashes and their doctor won't prescribe hormones because they were on them for 5 years. They say they're going to cause cancer. So we're going to let that person have hot flashes for the rest of her life until she can't sleep anymore. And then her immune system gets shot and then she gets cancer. Right. That's what we call good health care. That's what we call standard of care. Well, that is just, I'm telling you that because I'm giving you an analogy that if hormones cause heart disease, if hormones cause cancer, young women would die of heart disease and cancer, and they don't. In fact, women without hormones is what dies of that. And women that get cancer from birth control pills, breast cancer from birth control pills, which is very common, or relatively speaking, you can't compare that. No. Totally different hormones. Right. So that's what I got to say about the safety of bioidentical hormones.
And here's the other thing that we kind of touched on earlier when we talked about synthetic hormones. When young women are put on synthetics, their body is put into menopause per se, because those hormones are blocking your body's natural rhythm. So you put somebody in a deficit with a foreign product in you. I truly believe that's setting women up for fibroids, endometriosis. I mean, even if they're treating that. And quite frankly, that is a problem in my mind as we look down the road in that picture of that person, because they gain weight. So now we have more inflammation. We have more problems with diabetes, more heart disease, we could go down the road. So I think what we're doing in our medical system, in my opinion, is setting women up for failure in their health as they start going through changes of life or by the time they get to their 60s and 70s. I believe if it was me and I was given the choice to um, go back in time and relive my life, I would never go or ever taking a estrogen component that was synthetic for a birth control pill or a progestin for that matter, because I think that set me up for some failures along the way. And I mean, that includes my bones, that includes my muscles, that includes, risk for cancers. I mean, on and down the road. But these are all approved, folks,
by the FDA.
If you're on a birth control pill, it's approved by our government to say that it's okay for you folks because it's safe and effective. But we've never really looked down the road to say, what happens to you when you're 70? What happens to you over your overall health? So that's our opinion. Do your own research. I mean, that's kind of why we do this, is to give you some other tools to think about.
And there's a lot going on in this episode. And as we wrap this up, we want to try to keep these as short as possible, but there's a lot of information we just went over, and we could be here all day. The question we commonly get that we probably answer every day is, well, how long should I be on hormones?
Right.
And many of the people that are asking this, they're either starting, or some of them have been on it for a long time. And they come in, they go to their primary care doctor, not their hormone specialist, and he says they're dangerous. They should be on them they should go off them. And here's my comment, and we'll wind this up. If you want to have healthy bones, you want to have good sex, you don't want to have a dry vagina, you don't want to be wetting yourself, you don't want to have a strong brain, you want to have chronic urinary tract infections, you want to have poor muscle mass and saggy skin, then you will go off hormones.
Right.
And then that doctor can prescribe all kinds of drugs to prevent those kinds of problems, or you can just stay on your hormones and be healthy. I mean, that's really what I have to say about that. So that wraps up this podcast, episode 6. Stay tuned as we go through this series. We've got a few more episodes left, and I hope you really enjoyed it. Thank you for watching.